All right, folks, we are now joined by Karin Carroll. She is the Director of Public Health for the City of Gloucester. How are you today, Karin?
Pretty good, thanks. Thanks for having me, guys.
Can you just sort of let our audience know exactly what your role is in the role of public health here for the city?
Sure. I'm the Public Health Director. I report to the Board of Health in the city as well as up through the Mayor's office. And our department is responsible for the prevention of disease and harm and prevention of illness to all residents. And that runs the gamut from, can be a whole range of things. We have an inspectional services team that takes care of food safety, Title V, septic requirements, and also, sorry, just phone's always going off. And then we have housing inspectors that make sure that everything where people are eating, playing, living is meeting some basic sanitary standards that are really important for maintaining public health, like clean water, clean housing, all of those things. We also have a dental center within our Department of Public Health, our health department, and we have a number of grants for chronic diseases and prevention grants. So we look at a whole range of things, and that's more my interest, and my background is the chronic diseases and things. But we work with the schools on prevention. We do a range of programs and grants that focus on a whole bunch of things to do with our residents in the city. We also have what we call a public health emergency preparedness focus. We're part of the North Shore Public Health Coalition. We're part of the Cape Ann Emergency Planning Team. Public health and emergency preparedness go way back. In fact, about 10 years ago, I worked for the City of Gloucester as their public health emergency preparedness grant coordinator. So, which was really lucky because those years have really served me well in the last few weeks, and that knowledge. But basically in public health, we spend a lot of time planning and drilling for all kinds of situations. And for example, flu, you see us every season out and about doing flu clinics. That's an opportunity for us to practice disease prevention on a community-wide level and to try to suppress a disease before it takes hold in a community and causes a lot of disease and illness. So we work with evidence-based strategies that will reduce widespread transmission. So one of the other functions of a health department is to monitor communicable diseases as they occur and are reported through to the state Department of Public Health from usually a doctor's office or something like that. And these diseases range from Lyme disease, from foodborne illnesses, TB, any sort of communicable disease, influenza, and now COVID-19. Go ahead.
Could you say specifically how your job has changed and what responsibilities you have with the COVID-19 emergency?
Sure. We saw this coming probably a month or 6 weeks ago. We started to get really concerned internally. And I would say about a month ago, we activated what's called the incident command structure for our department. And we made some major changes with the support of the city and the mayor's office and the Board of Health. And we took my position and moved it solely over to what we call the incident command role for COVID-19 response. And at that point, it was me and my public health nurse, the chief firefighter and chief of police, and the inventory, John Sanger, our EMS coordinator. We kind of sat around and said, okay, how ready are we if this virus were to come to Gloucester, to Massachusetts? What would we do? What do we need to have ready? What do we need to be thinking about? And it just it just kept evolving as this has. You've all seen it. It's become more and more all-consuming every day. We learn more as we started to see it on the shores here in America. So we kept ramping up our efforts. So we went from a few of us in our structure, and I'll just add the incident command structure is a international system that is used, and we're all trained on. All city staff have to train at a very basic level of incident command. And the structure is used usually in emergencies like fires, disasters, It's a way to bring in a lot of multiple agencies, some that are part of the city and some from without, to have a coordinated response to an emergency. It also sets up things like span of control so that no one person is responsible for too many people or too many resources. It's just a way to divide up the work, really, is how I like to think of it, and who's in charge of what. So you're not spending time trying to figure that out and asking people to help you. It's people have specific jobs and they all report up through me. So I would be responsible for the overall incident. I have to establish the incident objectives, usually daily, and we revise those. And it might be today's objective is to get an emergency plan together for X scenario, or what we'll do with our homeless population if there is a problem there. And it depends.
Could you just give us a specific scenario? What would an X scenario be?
Well, let's talk about the contact tracing and the notification. So all of our local health departments, we knew would quickly become overwhelmed with the amount of people that we need to call and explain they need to go into isolation, that they have tested positive, answer their questions, and then start the process of tracing those who they came into close contact with during their infectious period. So that's done by a nurse. We have one nurse, and we knew really early on that that was not going to be enough if this thing really took hold. So we started working to hire some contract nurses to do some training. We now have some city staff and some school nurses that are supporting our efforts. They have to go through a training. So it's a complicated process. We have to set up under me. We now have I'm just looking at my chart, our operations chief is our head nurse, Kelly Highland. And she is really running this operation of now some 20 odd people we're going to have involved in this process in one way or another. They may be doing data entry, they may be assisting the nurses, but it's become, we've had to establish a lot of depth. They have to do training, they have to be recruited, they have to be supervised. So there's a lot to it. So that's kind of been one of the objectives over the last couple of days, is how will we manage this workload? And the other piece of that always is, how do we push back? As the incident commander, I push up to the mayor's office, and they push up to the governor, the state, DPH, federal resources, if we know we're beyond our capacity. And we do know on some of these things, we don't have the capacity we might need. So we push those things up, and that's great. Our mayor is very well connected with our governor's office and speaks to them frequently. So they can, any concerns we have, they can relay them, or even suggestions where we might say, hey, instead of all us little towns out here hiring 10 more nurses and training them, how about if we set up a bank somewhere at DPH or another organization that could do that in a more centralized way and, control those efforts. So that's the kinds of things as an incident commander I'm always doing, is saying, what are our big problems? Where are our gaps in resources? How can we, as a community, address those gaps? And we talk as a group. It's now up to about 30 people. We talk twice a week on a Zoom conference call like this. We have reports back from all of our subcommittee chairs. We have a public safety first responder committee, a school committee, and they're going through all the issues, a seniors subcommittee, looking at all of our vulnerable populations, what issues are coming up, what help they might need. So that's how it rolls out.
Regarding the COVID-19 emergency, what are the top 3 priorities that your office is dealing with right now?
Top 3, testing is, so from a larger public health point of view, it's testing, it's isolation and quarantine notification, and then it's those very specific high risk situations like homeless shelters, like nursing homes, that we want to make sure we have really, really careful attention on those places and support to those places and communication and backup plans. So I would say, testing, our department can't run testing. We don't have that ability, but we know it's a huge part of the public health response that there is still a large gap. So we can help inform the public and our medical community on Cape Ann. So as testing does become available, we push that information out to our providers. We continue to send that message up through to the governor's office that we do not have sufficient testing. And then other issues around testing, like priority ensuring first responders. What will that process be for getting them tested? Results, how are they being communicated back to people? Sometimes there's a lag between a lab or a hospital might find a result, call a patient before it gets through the state system and we call them. So dealing with those larger issues around testing, communication, that's our main thing. And if there's anything more we could do to help make testing happen, we would, because it's really hindering the whole managing of this public health situation. And then the second thing to fight this outbreak is to quarantine. Once you know who has it, if you can contain them and keep them separate, encourage them to stay home, self-isolate, you're going to slow down the transmission. So as you know, that's another huge part, as we've seen worldwide, of an effective response, is to be able to isolate and quarantine. And we do that in a couple of ways. I mean, some of it is just the constant messaging we've been doing to the public about when and how to quarantine and isolate. What's risky, what's really risky, who's at greatest risk, and to help them think through everyday situations like going to a grocery store. It's okay to do that. You need to do that, but do it carefully, minimize your trips, have someone go for you, wash your hands well after. So we're constantly doing that, and we're constantly having our food inspector, our business liaison, reaching out to these people to message quarantine. And it might come through, there's a call this morning with our local businesses, and it might be around going over the governor's orders about what's essential and what's not. But we always get that message in that if you're essential, if you're open, if you're doing something for your business or at your business, do it with all of the precautions that we've said as much as we possibly can.
Well, Karin, can we let's check back with you in a few days and
Okay.
just keep us abreast of all the things going on, because obviously it's a very fluid situation. So it'd be just be in contact with you to let us know how we can help as well.
Right.
Sure. Thank you. We appreciate that. Yeah. Appreciate everyone's help. Have a great day, you guys.
You too.
Bye-bye.
Bye.